Hi, my name is Lauren, and our group project was Healthcare, a Civil Right, and it was over constitutional mandates in regards to healthcare in America. You can go on to the next slide. Okay. So my position on this was I was the proponent, and being the proponent, I'm going to be speaking about how healthcare mandates are necessary. So I've broken it down into 5 points. Starting with the first one, we have a lot of current system failures with the way that our healthcare system is set up in America. Um, the way our system is working is it is failing Americans by a very large number, um, by providing extreme barriers to care and widespread medical debt. We have millions of Americans that are in a lot of medical debt right now, and we have a lot that actually avoid going to the hospital whenever they have any kind of health issues just because of the fear of being in debt or the cost of care, which obviously is a big problem because there should not be a price tag when it comes to your health. Um, why we believe constitutional mandates are necessary, right? So we believe constitutional amendments and mandates would be a proactive response to address the root of the problem, which is the fact that healthcare is extremely, extremely high in America. And when you have mandates on that, it'll prevent from extortion, and it would prevent from it to just be completely out of control. I mean, an Advil at a hospital is, one single Advil will be like $25, and we need to ensure fair access to healthcare for all Americans. Again, going back on financial burdens and disparities, you have vulnerable populations such as the elderly that are having to sacrifice things like food, water, clothing just to pay their medical bills because as you know, you get older, your health starts to decline and you end up being in the hospital a lot more. And this leads to choices between essential needs and medical care, which obviously we cannot have people put in that kind of position. And then you go into our fourth point, which is public opinion. During widespread polls, it was found that Americans believe that healthcare and healthcare access and cost was one of the biggest issues. It was actually seen on multiple polls as it being the number one issue in America. And then also with the way our system is currently, it fails to fulfill government obligations that are listed in the Constitution. The Constitution says that it's the government's duty to promote citizen welfare, and it's not doing that. So if we were to mandate costs on healthcare, it would help align with our Constitution and how um, we want to treat our Americans, and it would help rectify all of those injustices in our system. So that is the end of my slide.
Okay, my name is Taylor Humphrey, and I will be the critic for the presentation. So here we have the agreements column as to why healthcare should be a right. So pretty much, rights to healthcare would ensure fair access by pretty much setting healthcare prices at a lower cost, and this can help with creating like financial fairness among the richer and poorer citizens within the United States. Um, and it will help stabilize the economy by public health and ensuring access to healthcare services for everyone equally. So this way, the overall health of our population can improve. And this could lead to increased productivity within the workforce by like reducing absences of employees like on the job, pretty much like our essential workers. And this can also create new jobs within the healthcare industry, including like hospitals, clinics, and other related services. Within the disagreements column, we have that the government could intervene, and this could pretty much prompt government intervention and lead to like discussions about the reach of government authority into the private lives of individuals or just healthcare in general. And then there's also the fear of infringement of personal freedoms. So pretty much the fight for healthcare rights kind of echoes like historical instances where public health measures have kind of influenced public freedoms or personal freedoms, and personal choices might be superseded as a result to healthcare rights. So for the statistics that agree with the clause, the graph to the left kind of depicts how the pandemic directly affected each race economically and medically. So for each race, the economic impact of COVID-19 pretty much outweighed the impact of health on individuals. The African American and Hispanic communities both had the most infected individuals, which led them both into financial disparity in comparison to Asian and Caucasian Americans. Statistically, African Americans and Hispanics in low income communities were shown to have the least amount of individuals that had access to health insurance or that could afford it, which caused them to have to pay their medical bills more out of pocket and or in full. Um, so contracting viruses and suffering from underlying health issues is kind of something that's inevitable, and I feel like that justifies why healthcare should be an equal right. And for the disagreement statistics, this kind of goes hand in hand with the infringement of personal freedoms or the government intervention. So the graph to the right illustrates privacy infringement within the medical field. It shows three hospitals that pretty much violated HIPAA regulations and leaked patient information, which abandons the promise of confidentiality to patients. And this could be a potential issue of healthcare becoming a right.
My name is Shona, and as the illustrator, I've created a graph here on the right that displays financial healthcare disparities in 5 states in the US. And this data was obtained from the NIH. And what it's basically trying to show is how costly these disparities really are. But you might be wondering, like, what do they mean? So, to simply put, it means that there's significant differences in health outcomes and access to healthcare services based on various different factors. These disparities can result from unequal exposure to environmental risks, limited access to quality healthcare, and socioeconomic factors. When people experience high levels of poor health and chronic diseases coupled with low access to quality healthcare, it leads to more spending for medical care and lower labor markets productivity. This can be seen clearly in the visual on the bottom left, as there's been a significant increase in the economic burden of health disparities in the US in just 4 years. There was around a 41 increase in cost, and this was all being mainly caused by the fact that there was unequal and unfair access to healthcare services. So by making healthcare and its costs mandated in the Constitution, this problem that Americans are currently facing will be able to slowly fade away. Universal healthcare will help eliminate the burden of medical debt that individuals face, and it will help reduce the disproportionate financial burden on vulnerable populations such as the elderly or low income individuals who may otherwise struggle to afford necessary medical treatment. And lastly, it will help lead to preventive care measures being more widely accessible, which can ultimately reduce the need for expensive emergency treatments and chronic disease management. This will thus lower the overall healthcare costs for individuals and society as a whole. So before I move on, this graph and these facts here clearly state that by ensuring equitable access to healthcare services for all citizens, regardless of their socioeconomic status, a mandate will help alleviate financial healthcare disparities and promote a more equitable healthcare system.
Uh, Hi, I'm Joseph. I'm the skeptic for this. While a lot of people may think that it's a no-brainer to do universal health care, there are a lot of problems that come with it. Some are very obvious that anyone would know, and then some are some that people wouldn't consider. Obviously, first off, there's funding. The United States is not doing that well economically and is in debt, a lot of it. And adding this would just put a lot more burden and strain onto the financial well-being of America. There would need to be a way to solve that before we can even think about implementing universal health care and adding even more um, economic strain. Taxes are something that's inevitable with this. It's the only way that we could feasibly even consider in putting universal healthcare into effect at all. And taxes already is a problem that a lot of Americans do not like, and having to add even more will make them have to think twice about even if they want to add universal healthcare and if the benefits still outweigh the negatives. Right now, with the system that we have the choice, since there are a lot of doctors and there's a lot of people that don't go because of right now they're not able to go to them. There's a lot of doctors that we can choose from for any specific or their degree or their field or their experience. But if universal healthcare was placed and anyone could go to any doctor, then eventually you might not be able to get your choice of what doctor you want to see or how good they are or anything like that. And then obviously the salary will get cut for pretty much every doctor out there. It will decrease by a big margin if universal healthcare was added, because people will not be paying for them, at least not as much as they used to. So they will not get the big salary that they've been getting for many years now. And this is a graph of a comparison of the average salaries of medical professionals in different countries with free healthcare. The US, by a wide margin, has the most or has the biggest average salary for medical professionals. And the other three countries like Canada, the UK, and Mexico, they have free healthcare, but their salaries are obviously way lower than the US. But if free healthcare was added, the US will soon join them in having less of a salary than they do now. And that will cause a lot less people in the future to want to seek out the profession of a doctor or anything like that, because that's obviously one of the big benefits of becoming a doctor is the big salary.
Okay, so now that we're at the last slide of this presentation, let me just go over some key facts that were stated. We can first talk about a couple of the reasons that were stated in favor for a constitutional mandate for healthcare. We first have the fact that the current American system is flawed, failing to meet the government's mandate to promote citizen welfare. That healthcare disparities disproportionately affect lower socioeconomic groups and are only worsening over time. That the majority of Americans prioritize concerns about healthcare, which underscores the necessity for a systemic reform. And lastly, that mandating healthcare addresses the root causes of high costs, and it aligns with the government's fundamental duty to promote citizen welfare and rectify structural injustices in the system. All of these points, as well as the fact that healthcare disparities disproportionately affect those of lower socioeconomic status, are not only prevalent but also increasing over time, were backed up in graphs that were on the previous slides. So moving on to the opposing point of view, of course, there are going to be those who argue against government intervention, citing concerns about personal freedoms and infringement into personal rights. However, the need for equitable healthcare heavily outweighs these concerns right now. So, in summary, mandating healthcare in the Constitution is necessary because it will rectify systematic failures, fix structural injustices, and provide a framework for fair access and affordability. Currently in our society, money holds more value than actual healthcare, but with a mandate, they were much more likely to be valued equally, and this can be shown in the visual that I've created on the right, where I've used the seesaw to depict this. So, all in all, what we want to say is that the ultimate goal that can be achieved if healthcare and its costs are mandated by the Constitution is for healthcare and money to be valued equally. Well, this is the end of our presentation, and I want to thank you all for your time.